Gabapentin Enacarbil tablet, extended release, is used to treat moderate to severe restless leg syndrome and to relieve nerve pain following shingles, also known as postherpetic neuralgia. It is changed by your body to gabapentin and belongs to a class of drugs known as anti-seizure or anticonvulsant drugs. It is important to take this medication as directed by your doctor. The usual dosage is once daily in the evening, with or without food. Make sure to take it at the same time each day. Be sure to follow your doctor's instructions carefully for the best results. Before you start taking gabapentin enacarbil, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. For restless leg syndrome, take this medication by mouth as directed by your doctor, usually once daily with food at about 5 p.m. This dosing schedule is for people who are awake during the day and asleep during the night. If you need to sleep during the daytime and stay awake at night, talk with your doctor about your schedule before using this medication. For postherpetic nerve pain, take this medication by mouth as directed by your doctor, usually once daily with food for several days, then increase to twice a day with food thereafter. Swallow the tablets whole and do not crush or chew them. Taking this medication regularly at the same time each day will help you get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. Different forms of gabapentin are absorbed in the body differently, so do not switch from one form to the other without consulting your doctor. Remember to tell your doctor if your condition does not improve or if it worsens. Some common side effects of gabapentin enacarbil tablet, extended release, may include drowsiness, dizziness, loss of coordination, or blurred vision. These effects may improve as your body adjusts to the medication. However, if they persist or worsen, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many individuals using this medication do not experience serious side effects. A small number of people who take anticonvulsants for various conditions, such as seizures, bipolar disorder, or pain, may experience depression, suicidal thoughts/attempts, or other mental/mood problems. It's crucial to notify your doctor immediately if you or your family/caregiver notice any unusual or sudden changes in your mood, thoughts, or behavior, including signs of depression, suicidal thoughts/attempts, or thoughts about harming yourself. If you experience any very serious side effects, such as slow or shallow breathing, it's important to seek medical help right away. While a very serious allergic reaction to this drug is rare, it's essential to get medical help immediately if you notice any symptoms of a severe allergic reaction, including fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice other effects not listed above, it's crucial to contact your doctor or pharmacist. If you experience any side effects, you should also consult your doctor or pharmacist for medical advice. Before taking gabapentin enacarbil, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including kidney disease, mental/mood problems, and any history of drug or alcohol use/abuse. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid driving, using machinery, or engaging in activities that require alertness or clear vision until you know how this medication affects you. It's also important to avoid alcohol and marijuana while taking gabapentin enacarbil. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, which could include swelling of the hands/ankles/feet, slow/shallow breathing, dizziness, or loss of coordination. These side effects could increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of taking this medication with your doctor. Similarly, if you are breastfeeding, consult your doctor before using gabapentin enacarbil. When taking gabapentin enacarbil tablet, extended release, it's important to be aware of potential drug interactions that can affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Orlistat is a product that may interact with this drug. There is a higher risk of serious side effects, such as slow or shallow breathing, severe drowsiness, or dizziness, if this medication is taken with other products that may also cause drowsiness or breathing problems. It's important to inform your doctor or pharmacist if you are using other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's crucial not to use this medication with other medications that contain gabapentin, as it may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. As for daily dosage and optimal timing, it's best to follow your doctor's instructions for the most effective and safe use of this medication. If you or someone you know has overdosed on gabapentin enacarbil tablet, extended release, and is experiencing serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness and dizziness. It's crucial to get help as soon as possible in these situations. Remember, it's important not to share your gabapentin enacarbil tablet, extended release, with anyone else. This medication is specifically prescribed for you and should not be taken by anyone else. If you forget to take a dose for restless leg syndrome, do not take an extra dose to make up for it. Instead, just take your next dose at the usual time the following day. The same applies for postherpetic nerve pain. If you miss a dose, simply skip it and take your next dose at the regular time. Avoid taking double doses to compensate for the missed one. It's important to store gabapentin enacarbil tablet, extended release, at room temperature, away from light and moisture. Keep it in the original bottle and make sure the container is tightly closed. Do not remove the moisture control packets inside the bottle. And remember to keep all medications away from children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of this medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.